Hello friends, welcome to Vidya Edu World, and our today's topic of discussion is gene therapy. It is biotechnological application in medicine. So let's start. Nowadays, advancement in medical science treats almost every disease of humans. But what if a person is born with a hereditary disease or genetic disease? Can a corrective therapy be taken for such a disease? Answer is yes. Gene therapy is an attempt to do this. Many researches are going on about this gene therapy. So basically gene therapy is collection of methods that allows the correction of gene defect. You can see correction of gene defect that has been diagnosed in child or embryo. So here normal genes are inserted into a person's cells and tissues to take over the function of defected or non-functional genes. So this is about the gene therapy. If we talk about the types of gene therapy, then this gene therapy is broadly divided into two types, that is somatic cell gene therapy and germline gene therapy. Okay, so what happens in somatic cell gene therapy? As the name suggests, genes are transferred into the somatic cells of our body. So what are somatic cells? These are the cells in the body other than sperm and egg cells. That means all the body cells except reproductive cells. Okay, for example, our blood cells, skin cells, our nervous cells, all are included in somatic cells. As these cells are not involved in reproduction, obviously the corrections made in genes of somatic cells of any individual will not be inherited in later generations. Okay, so here you can see these corrections, that means corrections made in somatic cells will not be inherited in later generations. If we talk about germline gene therapy, here genes are introduced into the germ cells. So what are the germ cells? These cells are the cells which are involved in reproduction. That means eggs and sperms. As these cells take part in reproduction, the corrections that are made in germ cells are inheritable and passed on to later generation. Because we know that the offspring carries genes from their parents. Therefore, these changes are inheritable and passed on to later generations. Okay, so this is about the types of gene therapy. So there are two approaches or two ways by which we can deliver our gene of interest into the patient's body. Here you can see there are two techniques, in vivo gene therapy and ex vivo gene therapy. So what is the exact difference between in these two techniques? In vivo gene therapy, genes are directly delivered into the cells of a body. Here you can see direct delivery of genes into the body cell is known as in vivo gene therapy. Though it sounds so simple as if we are placing one thing from one place to another, but actually this is very challenging treatment as we are dealing with the genes of our body. What happens in ex vivo gene therapy? Here, firstly, cells are isolated from the patient's body to which gene correction has to be made. Then these cells are cultured in laboratory. Okay, so in ex vivo, firstly cells are isolated from patient's body, then cultured into the laboratory, and then genes are transferred to these cultured cells, and these cultured cells then they are reinserted into the patient's body again. Okay, so here you can see transfer of genes to cultured cells and reinsertion into the patient's body is known as ex vivo gene therapy. Then you might have question in your mind that how genes are transferred. So to transfer the desired gene into the target cell, a carrier is required. Okay, so such vehicles of gene delivery are known as vectors. So there are two main classes of vectors used in gene delivery. Viral vectors, for example, adenoviruses, retroviruses are used as viral vectors, and non-viral vectors like some polysaccharide macromolecules or inorganic nanoparticles are used as non-viral vectors. So these vectors transfer gene of interest into the host or patient body. We will see one example of how gene therapy was used to treat genetic disorder. So the first genetic therapy or gene therapy was given in 1990 to a 4-year-old girl with ADA enzyme deficiency. So what is ADA enzyme? It is adenosine deaminase enzyme. So this enzyme is very important for our immune system to function well, as this enzyme prevents early death of our lymphocytes due to toxic chemical deoxyadenosine. We all know that lymphocytes are the immunocytes or soldiers of our body who protect us against infections. Now, in this girl, this disorder of ADA enzyme deficiency was due to the deletion of gene for enzyme. Then let's see how this ADA enzyme deficiency is treated using gene therapy. So in the first step, lymphocytes from the blood of the patient are grown outside of the body on culture media. That means if you recall, ex vivo gene therapy is used here. Okay, so culture cells are used. Then the functional ADA enzyme producing complementary DNA. Okay, so ADA complementary DNA is then introduced into these lymphocytes using retroviral vector. Which vector is used? Retroviral or viral vectors are used. And finally, these genetically engineered lymphocytes are subsequently returned to the patient. Okay, so what happened in first step? Lymphocytes are isolated from the patient body. Then the functional gene of ADA enzyme is introduced into the patient lymphocytes, and these genetically engineered lymphocytes are subsequently returned to the patient body again. But the patient required repeated infusion of this genetically altered cell. Okay, so here you can see repeated infusion of this genetically altered cell is required because our body cells are mortal. That means they die after some time. So the genetically altered lymphocytes will also die after completion of their life. So repeatedly the genetically engineered lymphocytes need to be infused in such patients, which is very challenging job. So friends, we end up our topic with the advantages and disadvantages of the gene therapy. As we discussed, gene therapy has the potential to eliminate and prevent hereditary diseases. So it can be solution for the genetic disease. It is the major advantage of gene therapy. If we talk about the disadvantages, then the long-lasting therapy is not achieved by gene therapy because our body cells are mortal. That means they have short lifespan. So repeated infusion of genetically engineered cells is needed in human body. Another disadvantage is that immune response to the transferred gene can be given by patient body because the gene of interest we introduce into the patient body is foreign to that patient, therefore it may cause immunogenic response. And finally, viruses used as vectors may cause toxicity to patient. So this is all about the advantages and disadvantages of gene therapy. So friends, hope you find this video useful for your conceptual knowledge. So please like, share and subscribe my channel for more such videos. Have a good day.